This is an exercise for thumb radial and palmar abduction. You're going to have your hand as flat on the table as you can get it without forcing it. So if you can only get down to say here, then that's fine, that's good enough. You're going to start with your thumb right next to your index finger, and you're going to glide out to the side. And then nice and slow, back in and snuggle up to your index finger. And glide out to the side. And slide back in toward your index finger. And one more time, glide out to the side. And come in close to your index finger. If you're at a table or if you're at a table and you're perspiring or you're otherwise having difficulty sliding your thumb, you can use a little cornstarch on the table. Just put a little down there, smooth it out, and then have your thumb there, and that would help you glide. You want to do this the number of times prescribed by your therapist. So you want to see your home exercise notes. So next one is thumb palmar abduction. Thumb palmar abduction, again, you're snuggled up against your index finger, but this time you're kind of you're like directly under it, and you're going to come out parallel to it, out this way, and then back in, so you're kind of under your index finger. And a little help in terms of getting your brain around this exercise, because it's a little, it's not something that we normally think about when we do it. We do the exercise all the time, but it's usually with an activity. So what we would do is, this is the kind of movement that you would use if you were going to grab a jar or a cup. And then you would release and let go. So again, you're opening up your hand just like you were going to grab a cup, and letting go. So a few more times out here, like you were going to grab a jar. Slowly back in, bring it up against your index finger, and one more time out like you were going to grab a jar, and then bring it in to your index finger. Again, repeat per the number of times prescribed by your therapist. And when you do these exercises, you'll notice we're not going fast. This is not helpful, okay? You want to really move that joint, feel the joint move, feel the muscles work, and then gently and slowly move back to your starting position.